Risk factors of vascular dementia. Factors of risk. As is the case with heart disease and stroke, the risk factors for vascular dementia are virtually the same. The following factors increase your risk of developing vascular dementia. Years on years, your risk of acquiring vascular dementia increases as you age. Prior to the age of 65, the disorder is uncommon, but the danger climbs considerably in your 90s. In the past, heart attacks, strokes, and mini strokes have happened. If you have had a heart attack, you may be at an increased risk of having brain blood vessel anomalies. When a stroke or mini stroke or transient ischemic attack occurs, the resulting brain damage may increase your risk of developing dementia in the subsequent years. The abnormal aging of blood arteries, atherosclerosis. Atherosclerosis is a condition that develops when deposits of cholesterol and other substances from the arteries obstructing the flow of blood. Atherosclerosis increases your risk of getting vascular dementia by decreasing the blood supply to your brain. Cholesterol levels are abnormally elevated. High levels of low density lipoprotein, more commonly referred to as poor cholesterol, are associated with an increased risk of developing vascular dementia. Hypertension is a medical condition. If your blood pressure is excessively high, it puts additional strain on blood arteries throughout your body, including those in your brain. This increases the risk of developing cerebral vascular disease. Diabetes, increased glucose levels can wreak havoc on the blood arteries throughout the body, including the brain. Damage to the brain's blood vessels can increase your risk of having a stroke or developing vascular dementia. Smoking. Tobacco use directly damages the blood vessels, increasing your risk of developing atherosclerosis and other circulatory problems such as Alzheimer's disease and vascular dementia. Obesity. Being overweight is a well established risk factor for vascular illnesses in general. Therefore, it makes sense to infer that being overweight increases your risk of acquiring vascular dementia. Atrial fibrillation is a fast heartbeat disorder. This form of an abnormal cardiac rhythm is defined by the rapid and irregular beating of the upper chambers of the heart, which are out of phase with the lower chambers. Atrial fibrillation increases the risk of stroke by causing blood clots to develop in the heart, which can break off and travel to the brain's blood vessels.